Good morning, everybody. Welcome to another episode of PEM Rules. I'm your host, Yaron Ivan, as usual. And today we have some more important discussion about some important rules, some of which have to do with resuscitations, which I don't do very often in the pediatric emergency department, but certainly when I do, it's a very big deal, and often a lot of people are involved, and it's a lot of teamwork. Let's get started. Rule number 101. Remember the partially treated disasters. So again, as before, I'd like to demonstrate that rule with an example. It's fairly often that I see a child in the ER that is highly febrile, tachycardic, maybe tachypneic, who has been seen maybe by multiple providers, maybe even multiple emergency department, got some amoxicillin maybe for otitis media, sometimes ceftriaxone intramuscularly, and sometimes those parents with those children present to the pediatric emergency department after several days of bouncing between providers or between emergency department with no significant relief. And during that time, they may or may not have been treated, sometimes with 1, 2, or even 3 antibiotics with no significant help. I always tell my residents that yes, this child likely has a viral illness, which is why the antibiotics is not really doing anything. He's still febrile, he's still congested, he still has viral symptoms. We all know antibiotics, unfortunately, don't do a whole lot for viral illnesses at all. Therefore, he's still symptomatic. However, I think it's extremely important to keep in mind that given the amount of antibiotics this child may have gotten, it is very possible, although less likely, that this kid truly has some significant serious bacterial infection, maybe bacteremia, maybe meningitis, and because he gotten so much antibiotics for so many days, he's really doing okay, stable, etc. I call it the partially treated disaster. Yes, you cannot really treat bacteremia with PO antibiotics, probably not meningitis either, but if you got IM ceftriaxone and a lot of amoxicillin for days, and you are actually bacteremic, perhaps that has some effect, and you will remain stable and fairly okay, but truly you have a disaster brewing inside you. So when you see a child that has been getting a lot of antibiotics, still febrile, still unwell, yes, you should entertain the possibility of a viral illness, and if the child looks fine, maybe just provide anticipatory guidance and send the child home, make sure the parents know what to watch for and what to do, make sure the vital signs are stable, etc. But remember, if this kid got a lot of antibiotics recently, and he's still febrile, maybe not particularly well appearing, you should entertain the possibility of a partially treated disaster, partially treated bacteremia with PO antibiotics, partially treated meningitis with PO antibiotics. Those kids can do okay because they are getting treated. However, that PO treatment may mask some serious symptoms that actually should be there. So remember the partially treated disasters. This situation in my mind is not very different than the child with asthma who's coming in with maybe mild or moderate distress. However, mom is telling you, and you should ask, that he's been getting treated with albuterol every 4 hours for 3 days. Again, mild distress with albuterol every 4 hours for the last 3 days is very different than mild distress with the patient who hasn't gotten any albuterol at all. So remember the partially treated disasters and think is something being masked. Rule number 102. Summarize your resuscitation at the end and ask what else can we do for this child. So this is actually a rule that I learned and saw with my own eyes in residency when I arrived in the pediatric emergency department to admit a patient, and I noticed on the other end, there's a little bit of a commotion, a lot of people getting together, and I quickly learned that they were resuscitating a newborn baby. The attending was one of the more experienced attendings in the pediatric emergency department. I've seen him there before many times. He's probably have been doing it for 15 or 20 years. And after 20 minutes of CPR and several doses of epi, I heard him say something to the extent, "Okay, team, thank you very much for your help. We have been resuscitating this child for 20 minutes. We have given IV XYZ. We have given the following medications. Can anybody think of what else we can do for this child?" I remember I was really surprised by that statement because actually he is the attending and he's actually asking for help and advice from his team, some of which are nurses who are very young, or even pediatric residents who have been a doctor for a year or two. I thought it was very humble, and I thought it was a very, very good idea. So it's probably something we should all do at the end of every resuscitation. Remember, during the resuscitation, a lot of time, that nurse, that respiratory therapist, whoever is helping you is very focused on one task. And it's very, very easy to get lost within whatever it is that you're doing. Summarizing what we did for the child, what the child has been given, etc., can be very helpful for the team, so everybody learns what have we been doing in case they kind of got lost in their task. In addition, I think it's a very good idea as an attending to summarize what you did and ask if there's anybody who thinks there's anything else we can do. I can't tell you how many times my nurses or my residents or my respiratory therapists thought of something that I did not think about, whether it was a diagnostic test or a treatment. I think it's a very good idea to ask for help and know what you don't know. Be humble and be aware that maybe a member of your team will think of something you did not think, and maybe somebody will have a suggestion that can improve your patient's outcome. So I think it's very important to end every resuscitation with a summary and asking the team if there's anything else anybody can think of we can do for this child. Maybe that respiratory therapist will have an idea. Maybe that nurse will think of some treatment that you totally forgot about. It's totally fine. It all serves the best for our patient. It's probably a good idea. So remember rule number 102. Summarize your resuscitation at the end and ask what else can we do for this child. Rule number 103. Make sure you huddle. So this is another rule related to resuscitation that I learned mostly as an attending. And again, even as a pediatric emergency department, I don't resuscitate kids very often. Most patients that I see in the pediatric emergency department are really okay. However, every once in a while, we are part of a resuscitation that may or may not go well. And I find it very helpful for future resuscitations, and I think my team really appreciates it, if after everything is said and done, we get together and huddle. I usually start that huddling with thanking for the team for everything they did, and summarize what we did and what we could have done better. And I always ask other people to participate, tell me what they think went well, what they think did not go well, and what can we do for the future. Number one, I think it's the right thing to do for our patient. We can all learn from our mistakes. What can we improve on, etc. Number two, again, as an attending, I have a very certain point of view. My nurses, my residents may have seen something that I did not. And if we can do something better next time, by all means. So remember, at the end of every resuscitation, when the commotion is all said and done, when things are a little bit more calm and you moved on, make sure you find a team that helped you out and huddle with them. Talk about what we did, what we didn't do, what we maybe could have done better. Maybe take some notes. I sometimes even send an email to the team a day or two later, again, thanking them and reiterating what we discussed in the huddle. I think the team really appreciates it, and most of all, it serves to the best of our patients, and it's a learning experience. Even experienced providers may forget about a test or two they could have done. Even as an experienced provider, as an attending who's fellowship trained, there's always more to learn and more to learn from others. So make sure you huddle after every resuscitation. And that is it for today, guys. Thank you very much for listening. Let's review what we learned. Rule 101. Remember the partially treated disaster. A child with high fever who's not particularly well appearing and has been treated with a lot of antibiotics recently for whatever reason. Yes, he can have a bad viral illness, no big deal. But this could also be a case of meningitis or bacteremia, and the child is doing okay because he's been getting PEM antibiotics which have some effect. Rule number 102. Summarize your resuscitation at the end and ask what else can we do for this child. It's the right thing to do for their patient. It makes the resuscitation more effective, and maybe somebody will come up with an idea that you did not think about that will actually make a clinical difference. Rule number 103. Make sure you huddle after every resuscitation. Again, it's a learning experience. It's the right thing to do for our patients, and it's something that the team will greatly appreciate. There's always more to learn, and there's always things to improve on. And there's no way to do that if you don't summarize what happened, what we did, etc. And that is it for today, guys. Thank you very much for listening. I appreciate it. please make sure you check out PEMRules.com. Please sign up for the newsletter and look at the link at the homepage of how you can contribute to our educational project. I appreciate your support. Thank you very much. Special outro for today. Shout out to my friends Shrenik Shah and Jason Hinman, members of my college band, The Basement. We had a lot of fun playing together. And this is a song that I believe Jason wrote. It was called What I Want. I had the pleasure of playing the drums in that band. Had a great time during college.